Now, it's Red Eye Radio. Gary McNamara and Eric Harley talk about everything from politics to social issues and news of the day. Whether you're up late or you're just starting your day, welcome to the show. From the Uniden America Studios, this is Red Eye Radio.
All across America, we are Red Eye Radio. He is Eric Harley, and I'm Gary McNamara. Good morning. Oh, yeah, we mentioned her last hour. I just want to say one more thing. Because people have heard the name Jennifer Welch and really can't play much of her audio because it's F word this and F word that. But the Democrats love her. They believe they found their new Joe Rogan. The New York Times wrote a good column on her. She's completely a clueless former reality star from Bravo who is completely clueless on the issues. They just needed to find a new face that will be a flamethrower. That doesn't know the facts, doesn't have a clue, doesn't know how the real world works, but they don't care. They just got her out there. She's out there cursing, and she's a new face. Yeah. It's really interesting because I wonder whether all the new faces become tiring very quickly. For example, is there a ton of support? Do Democrats, because since Jasmine Crockett announced in Texas, for the Texas Senate, is there a short, do you wear out quickly?
Yes.
With even Democrats? Because
I was thinking the same thing, because if you think like Colin Allred, he hasn't been in office forever, but it's been several years. He's even run for Senate here in Texas before. And then I said almost jokingly, halfway jokingly, Beto is kind of old news. He's also not a winner. But what is the half-life, the efficacy, impact of any, I'll look at it like I do my prescription drugs, of any of those on the left? Because AOC, sorry, she's starting to age out a little bit. I'm just saying a little bit. I'm not saying she's past her prime. But the point being is that once you've been out there, because if you've got nothing, right? If it's just this performance art that it seems to be, which I believe it is, it's only performance art, and they're clueless on the issues, then you really only have the moment. There's nothing to fuel that fire beyond, because there is no foundation. There is no fundamental belief. There isn't something that you can relaunch and educate people on and carry that on to a movement. So they're leapfrogging, basically. It's a lily pad type move where it's on to the next one. Now, for a moment, I think they thought they had Stephen A. Smith, but they don't.
Well, but I mean, when you look at Jasmine Crockett, I expected there to be a groundswell of support, and you didn't see it.
No,
you didn't see it like you did Mamdani.
Right.
Now, not that he got all support, but he did get the radical left support. And do they view her? Do they look at her and say, she can't win in Texas, and so we shouldn't be? Even the radical left is saying she can't win in Texas. Mamdani, he can win New York City,
right?
But we've got to take these things where we can get it. But no, we need the radical left might be saying we need somebody who can actually win in Texas, who can pretend that they're more conservative. Because I was amazed. I really expected that by today, you would have a ton of support and endorsement for Jasmine Crockett.
I thought you were going
to
see it. I thought you were going to see it in the 24 hours after she announced.
Because remember, Doofus Beto got it.
Right, yeah.
And think about
remember how they tried to build him up. It was, obviously it's the local media, here in the state of Texas, but, I mean, they were following him everywhere. He's skateboarding in the parking lot at Whataburger. Yeah, you know what they call that? Being drunk.
Well, actually, he got national publicity. Remember, he drove around with the other congressperson?
Oh, yeah, it was Will Hurd.
Yeah, they
because their districts were when Beto was serving in the El Paso district. Will Hurd's district was the adjacent district, and Will Hurd was a moderate Republican.
But it was like, but they're driving to meet them. I don't give a damn I don't care whether they fly, walk. Well, he's taking a 1,000-mile walk. I don't care. Where do they stand on the issues? That's all I give a damn about. I don't care about anything else.
Well, remember what Beto said? One of his answers was, I forget what the question was, what the issue was. I'll contemplate it, and I'll let the people decide.
Oh, yeah, he got in that mode.
It's like, no. We need to know what your convictions are.
That was gun control.
Was it gun control?
That was gun control.
This is... And this is the problem. And I think you're onto something with Jasmine Crockett, because it is, and I've said before, it's almost as if the left, the Democrats, are okay with having control of the major cities, the major blue cities, and which most major cities are blue, and the blue states, because they realize, look, this is what's giving us our strongest leverage, and everything else, of course, their little experiment isn't working. So they do leapfrog on to other things. Now, I don't think they're happy with just having that kind of power. But certainly knowing they've got all the major cities under control, which, again, those are the population centrals for all of those states. That's the key to winning elections in states. It can be. And so those, I think, on the outside are looking at Jasmine Crockett saying, all right, look, she can make some noise. She spoke about turning Texas blue. She's not going to turn Texas blue. But I think the Democratic Party probably looks at that, or other Democrats, I don't know about the party itself, but other Democrats look at it and go, uphill battle. She's not going to win that race. But if she makes enough noise, okay. Kind of like, and keep in mind, Beto outperformed what a lot of people thought he was going to do when he ran for Senate. Didn't he win? Did he win Tarrant County? I mean, I know that's not how they break it down. They break it down by precinct.
I can't remember.
But there, he made some inroads. But again, ultimately, what was it? Well, there was no fuel for that fire because there's no conviction. They don't stand for anything. And they are clueless, which means they can't openly debate when Jasmine Crockett is off script, when she's on a debate stage or in an interview with anybody that asks any kind of opposing question or makes an opposing point. She's useless.
Because I look, and I'm going to go outside the J.D. Vance just because he's part of the administration. I'm trying to find people that are rising stars in the Republican Party outside of the administration. But you look at Ramaswamy. Look, Ramaswamy came out and said, Republicans failed. We got our ass kicked.
Yep.
And he was blunt, and he said, we've got to tackle affordability and tell precisely what we're going to do.
Yep.
And that was a criticism of the Republican Party and therefore the administration for actually not coming up with a plan and articulating it to the American people. He suffered nothing for that.
Right.
In fact, you look at
it. In fact, it caught fire because other people in the GOP started saying affordable.
Right.
And
so, but you look at him and he has risen because everything that he talks about is ideas. It's ideas.
Right.
He's not really a flamethrower at all. And the other one I would look at would be DeSantis. People look and say he's still very popular in Republican circles.
Yep.
And so, but you look at it, you've got these people that, the flamethrowers that come out. And that's why I look at the, Jennifer Welch, and it's like, nobody's going to be talking about her a year from now.
Right.
Because her mind is vacant.
Yeah.
She's got nothing there. There's nothing up there. She isn't somebody who understands how issues actually work. And one of the problems for Democrats and liberals, they don't really know how the world works.
I'll say this. There were things, if you talk about the influencer effect of 2024. You include, Joe Rogan. Remember, and you bring up that point that, the left is, we need to find our own Joe Rogan. You had the Joe Rogan for years, but with him, with the late Charlie Kirk was different than Joe Rogan.
Oh, completely different.
Charlie Kirk started a movement and turning point that you just cannot deny, because he was taking that debate out to, ground zero, the universities, and talking with the younger generation, debating the younger generation openly, and you knew that there was conviction there. I would say Joe Rogan, more, not that maybe he didn't have some influence on the election, but he jumped on the movement more than caused the movement. He wasn't the cause of the movement. He wasn't leading the movement.
No,
the momentum was there without him.
Well, he's sort of he's somebody who recognized, because you make a great point. Charlie Kirk was always on that side.
Yes. And doing the work.
Right. What God, and Joe Rogan basically asks questions,
right,
is what he does.
Right.
He brings on guests and asks questions. And I'm not demeaning him for doing it, because he does he does a great job in,
but the effect of it all.
In doing it. But he gained popularity because he had a massive audience, and he went from being a downright supporting a communist socialist, Bernie Sanders, to completely rejecting the left.
Right.
And so that's what got him, because he had such a great audience. That caught the news. By the way, the Jennifer Welch, did you see where she called Charlie Kirk's wife a grifter? Said everything that she, which again, she was out there yesterday. You saw, or the other day, Charlie Kirk's wife talking about, was she on Fox? Was it talking about the conspiracy theories, which really has to be hitting Candace Owen and others who are just throwing out conspiracy theories about his death.
Yeah.
And a grifter is somebody is a swindler, that she's come in now to swindle everybody.
Right.
To run Turning Point, which of course is ridiculous. But
when you have no conviction and you see someone of great conviction like Erica Kirk and the late Charlie Kirk, and the movement they created with Turning Point, then the only thing you can do is attack them personally, because you see that they're having an impact,
right?
And that's the whole thing is that Joe Rogan, all right, some impact. Maybe other people became a part of the discussion or aware of what Trump stood for. Theo Vaughn, same thing by having Trump on,
but they all ask questions is what they do more than they're
right. They're the movement itself, the momentum itself, to the point of any new influencer on the left, the movement itself isn't created in that way. It's unless you're doing the work and doing it for years, like Charlie Kirk did, and in a way that is meaningful, with a foundation and conviction in a real way, and that the debate, honestly, he could debate and would debate anybody at any time. That's the point. The left, they do the name calling. They have no convictions, so they're not about to debate anybody. And if it catches fire for a moment, it's one matchstick. It's going to burn out pretty quick.
Well, remember Jennifer Rubin?
Yeah.
Where is she now?
Right.
You don't hear anything about her anymore.
No.
And she actually came from, the Washington Post, opinion writer, everything else.
Yeah.
But she was a flamethrower, and, boom, it's like they get so ridiculous, they're gone.
Right.
And Jennifer Welch comes out there. I mean, everything she says you can tear apart, and it's self-evident. It's like, well, no, that's not true. That's not true. That's ridiculous. Well, now you're just name-calling. They're starting out. Jennifer Rubin actually started out as an opinion columnist, where she was actually explaining things. Then as she became more radical and more TDS, then it was easier to say, okay, this is emotional. This isn't critically looking at something. This is just emotional garbage, or just a rage. And what you get from Jennifer Welch is it's almost like, okay, We found somebody who just is raging every day and is a different face, and that's what we need because AOC, been there, done that.
Right.
And even Jasmine Crockett, okay, we don't believe that she's effective, because I really thought that by the time we got to the end of the week, we're almost there, that there would be some type of groundswell support for Jasmine Crockett, and there's been nothing.
Right.
It's as if she didn't even announce that she's running for Senate, and
Yeah.
she is the one. She was up in the poll, the first poll we saw, 18 points.
Yeah.
And nothing. No excitement, nothing.
Right.
No, okay, let's at least go sis boom, rah, rah, rah. Let's cheerlead. Let's fake cheerlead. Because that's the thing. Both parties actually have their influencers on social media that fake cheerlead everything.
Oh, yeah.
They may not even buy into it. They're like, rah, 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 this is great. This is wonderful. This is the best thing ever. You don't hear that.
No.
About Jasmine Crockett.
Right. Yeah, it's again, because really the question is not whether Texas will go blue, it's who will be the next GOP senator.
Now, yeah.
So.
We are Red Eye Radio.
Brought to you by FPPF, Fuel Power Max.
Surviving and thriving as an owner-operator has just as much to do with managing costs as it does with generating revenue. Understanding basic principles of operating costs can save you thousands of dollars a year. Costs are not the same each month. If 9,600 miles are driven one month and 10,000 miles the next, two different sets of costs apply for each month. For example, if your tractor payment is $1,850 per month and you drive 9,600 miles in the month, your tractor payment is costing you 19.3 cents per mile. Drive 10,000 miles, though, and that same payment will cost you 18.5 cents per mile. This is one of your major fixed costs while paying off a truck loan. The difference in this example is only a fraction of a cent, which may seem like small change, but it ultimately amounts to $960 more annually on the bottom line. Because though fixed costs do not go down over time, you can reduce your cost per mile with more paid miles. Owner-Operator Business 101 is provided by Overdrive's Partners in Business program. Go to overdriveonline.com to the Partners in Business section of the website for more details on this and many other topics. Brought to you by Shell Rotella, with advanced synthetic technology is designed to help keep your rig running with more mileage and less maintenance.
We'll be right back with more Red Eye Radio with Eric Harley and Gary McNamara.
We're Red Eye Radio. He's Eric Harley and I'm Gary McNamara. Coming up on the bottom of the hour. You see that story about the woman in Canada who was approved for assisted suicide instead of getting surgery because she can't find a doctor? Wow. And that came out as we're talking about healthcare and where we go with healthcare.
Yeah.
Also, the Fraser Institute has put out their waiting time list again, and it's the second longest ever to go from a general practitioner to a specialist. But yeah, the story of the Canadian woman from Saskatchewan.
Well,
consider assisted suicide because she cannot get a needed surgery for a rare disease, which is causing extreme bone pain, nausea, and vomiting. She doesn't want to live anymore because she can't get the care that she needs in Canada.
It's heartbreaking and maddening at the same time, and then we still hear the push for single payer. Here, it's politically, it's not on Capitol Hill at the moment, but it is right now. The whole Obamacare subsidy thing is related. Who's going to pay for mine? Who's going to pay for mine? Who's going to pay for mine? And remember, we're the U.S., Gary. We could do single payer right. Remember that call we got? Yeah, we'll do it right, not like other nations.
This holiday season, give the gift of the Red Eye Radio app. Merry Christmas from Gary McNamara and Eric Harley. Red Eye Radio.
And we're Red Eye Radio. He's Eric Harley, and I'm Gary McNamara.
By the way, also Merry Christmas from our production crew.
Yeah.
We got a great, I don't remember their names, but they're good people. Alan and Ron, they're the best.
Let me see, Beavis and then Butthead.
Yeah. Alan and Ron, they are the best. And also Merry Christmas from our whoever our salespeople are. And and Merry Christmas from our friend Dan Mandis, who is part of the Red Eye family.
Right.
And we can prove that because he'll be here tomorrow. We are taking a 3-day weekend. I have worked enough full weeks for a lifetime. So, last week I didn't work a full week. This week, I'm not working a full week. I'm not a chump.
Yeah. And our management wishes you a happy winter solstice.
That's right. And clearly management has something on Dan Mandis because he keeps getting forced to fill in for us. So, I don't know what they got on him, but they got something. But no, our audience loves Dan. We love Dan. He is a Marconi Award winner. And for a reason, for a number of reasons, and join him tomorrow on the show, and then we'll be back Sunday night, Monday morning. As I don't know, the healthcare thing starts to shape up. We don't know what's going to happen, but we'll be back Sunday.
Talking
night,
about healthcare here we go. CBC covered this. A woman suffering from a parathyroid disease has revealed that she is considering assisted suicide because she cannot get the surgery that she needs. Joan Van Elstein from Saskatchewan suffers from a rare form of the disease, which results in extreme bone pain, nausea, and vomiting. She requires surgery to remove the remaining parathyroid, but no surgeons in Saskatchewan are able to perform the operation. In order to be referred to another province for the operation, she must first be seen by another specialist, yet those specialists are not accepting new patients in Saskatchewan. She commented that the pain has become so unbearable that she has applied and been approved for Canadian euthanasia and the assisted suicide program from something that is not terminal that can be solved. I want to live in that society.
My gosh.
So hopefully she gets the care that she wants.
I'm praying there's some kind of intervention here, that something happens.
Well, the story actually became popular because it was Glenn Beck who said, I'll pay for surgery if she wants to come to the States.
Wow.
So
we love Glenn.
Yeah. So that was...
He's a great man. He's a good man.
So what came out then was the Canadian median healthcare wait times now. The Fraser Institute does it each and every year. The Canadians' median healthcare wait time hits 28.6 weeks, the second longest ever recorded. Down from last year. I guess last year was the worst. In 2025, physicians across Canada reported a median wait time of 28.6 weeks between a referral from a general practitioner and receipt of the treatment, down from 30 weeks in 2024. This is... Just so people know, 1993 is when they went to the nationalized health care. It was 9.3 weeks in 1993. Now it's 28.6 weeks. Wow. Wait times have decreased in Alberta, Saskatchewan, Ontario, New Brunswick, Prince Edward Island, while increasing in the other 5 provinces. Ontario reported the shortest wait time, 19.2 weeks, followed by British Columbia, 32.2, Quebec, 32.5. Patients waited the longest in New Brunswick, 60.9 weeks.
Oh, my gosh.
Prince Edward Island, 49.7. Nova Scotia, 49. The national 28.6-week total wait comprises 2 segments, referral by a GT to consultation, 15.3 weeks, an increase of 13 weeks recorded in 2024. Consultation with a specialist to receipt of treatment, 13.3 weeks, a decrease from 15. Among the various specialties patients waited the longest, neurosurgery, a year, 49.9 weeks. Orthopedic surgery, 48.6. To compare that to the United States, orthopedic surgery, I don't have it where every one where, because I'd like to find it. I just did a quick search here. Orthopedic surgery in the in the United States. How long do you think, if you need it, from general practitioner to whatever? If you need it, it's something that you need.
Yeah, I don't know. I'd say it's
12 days.
I was going to say 2 weeks.
12 days. Yeah, close enough.
Yeah.
Patients face shorter waits for radiation oncology, 4.2 weeks. Medical oncology, 4.7 weeks. After seeing a specialist, Canadian patients waited 4.5 weeks longer than what physicians consider to be clinically reasonable, 8.8 weeks.
Wow.
Patients also suffered considerable delays for diagnostic technology, 8.8 weeks for a CT scan.
You know, I've been in ER situations where they took me, and we're good, within like a couple of hours. This happened a couple of times. I have an issue with one of my lungs, and they took me in for a CT scan both times probably within 2 hours of arriving at the ER. Boom. And because, you know, there's the thing. Diagnostics is the key.
Yeah.
It's everything. It's where you begin. And if you don't know what you're dealing with and you've got to wait what seems like an eternity, my gosh. That's supposed to be compassionate care?
18.8 weeks for an MRI.
Wow.
Yep.
Wow.
So waiting time's up in the United States, though, but still way lower than what you see in Canada.
I ran into that recently, actually. Yeah. And a lot of it has to do with the shortage of healthcare workers. There's a tremendous shortage of healthcare workers out there right now. And anytime that there has been any kind of delay, recently for me, just anecdotal evidence, but any kind of delay, it always comes back to, sorry, we're short-staffed. We're trying to get to everybody as soon as possible.
Oh, so this is just a great story. I get a text. Because I'm a type 2 diabetic, my standard visits to the doctor is once every 6 months. Mm-hmm. And when I first got it, it was like once every 3 months, then once every 4 months, once I realized I had it under control.
Yeah.
And then it's once every 6 months.
Yeah.
They just want to,
I'm on a 3 or 4 month.
Okay.
thing.
So,
yeah.
So my next one is in March.
Right.
So I get a text message yesterday. Your appointment has been canceled. And that's it for that date. Then I get an email. Your appointment has been canceled. You will be contacted by the doctor's office with a new time.
And this is for the March appointment?
The March appointment, yes.
Yeah.
And then I get a phone call from the doctor's office with the automated voice that your appointment, and this over a period of an hour and a half. And when I tried calling immediately when I got it, and they were on lunch. It was lunch, so it wasn't there, and their lunch was an hour, so I didn't. So I finally got a hold of them, and they said, no, your appointment's fine. We've had a malfunction in all of our offices. Every appointment from tomorrow through 2026 has been canceled.
Boy.
I'm like, well, I just said, I'm not going to keep you then. I started laughing. I'm not going to keep you then because
what a nightmare
your life right now must be absolute hell.
Yeah.
I go, every appointment? She goes, every appointment. The notifications have been sent out. It's simply a glitch in the system. And then after I got off, she goes, your appointment is still in March at that time and everything is fine. I get off the phone with her 15 minutes later. My phone rings. It's the automated voice again saying, your appointment has been canceled.
Well, because I'm thinking now in my mind, maybe it's because it's this time of year, then the chaos that ensues is like, It's a Wonderful Life at the bank, where all the patients show up and like, we want our appointments. We want our appointments. Jimmy Stewart's
Yes.
still there. What happens to the aspirin, Bob? Where's all the aspirin?
Will you take $20?
My lips bleeding. Hey, Bert, my lips bleeding. It's
I know. It was
I
just-
can't imagine. That would have to be one of those moments like, oh, this is going, because if it's manual data input without a backup, it's going to take probably weeks, maybe a week or
Well,
two.
nothing was canceled. It's just the glitch sent out.
I know, but,
Yeah.
but where do they have the backup to know where they can repopulate the system for that digital schedule that basically controls everything?
Right. Well, what she explained to me is it was a glitch of the phone calls that
The
on
notification system.
the notification system
Okay.
messed up.
All right.
All
That's
of the
good.
all of the appointments are still there.
Okay.
Right. All the appointments
Oof.
are still in.
They had to have.
And I checked it on the portal.
That's when
you
you want.
go-
That's
yeah.
when you want whiskey in your desk.
Yeah.
When you go, let's do a shot because all the appointments are still there.
Well, the thing is,
We
too,
can
so
breathe.
I got 4 notifications.
Yeah.
I got 2 phone calls,
Yeah.
then the text, and then the email. And I got one of them after I called. They said, no, everything's okay. What I did was when I got the 4th message, I checked the portal, and
Yeah.
my appointment's still there. So
Yeah. I love the app thing. I don't like calling the doctor's office anymore at all. It's like, because you're going to wait for a couple of minutes before they can get to you because, the phone's always ringing there. And the app thing has made it so convenient.
Well-
It's like, I have to make a phone call? Why?
And the one thing that I like, I don't know if other people like it, but my blood work now comes from the lab right to me before the
Yeah.
doctor even looks at it and
Yeah.
explains it.
I like it.
Which is why the one time, 6 months ago, I panicked.
Mm-hmm.
I'm looking at my blood work. I go, what's this thing? It says a little bit high. It says low, below average.
Mhm.
And it was one of the white blood cell counts. I'm like,
Mm-hmm.
I go, well, I'm in there tomorrow. And he hasn't commented on it yet. And then he commented on it after he commented, and I didn't see him mention the white blood cell thing. Well, I walk in, and my doctor says to me, oh, good. You're down a couple more pounds. Everything's looking great. What do you mean everything's looking great? What about my white blood cell count? He goes, what do you think you have, leukemia? I go, I don't know. You're the doctor. He goes, when was the last time you were sick and had a virus? And I remembered it. It was 3 years ago. I said, 3 years ago. He goes, that's why.
Yeah.
Because that's the white blood cell count.
And Gary, quit bringing your priest to all the doctor visits. It's not necessary.
Oh, yeah. I mean, it's just.
No, that's the thing is that, and they will tell you when they started that a few years ago with my doctor, it was like, hey, the doctor's going to send you the summary. You're going to get the report ahead of time. The doctor will follow up with a summary. So basically, wait for the doctor's summary. Don't get on WebMD for any reason. I'm on WebMD. What does that mean? What does that mean? No, it's no, I love the fact that you can manage your health, with that technology. You can at least monitor, and then your doctor can sort it out and tell you what it means.
Okay, I really didn't panic that much
Yeah.
because I know my doctor. He would have said something when he
Yeah.
did comment. I knew, but I mean, I do come in. And he's like, "What about my wife? Any questions? Yeah, my white blood cell count. What's that thing?
Yeah.
Oh, the one that's low. You think you got?
Yeah.
I love the way he said it though. You think you got leukemia? I went. It runs in the family. He goes, actually, it doesn't. He said because I've got some cousins and like 3 people have got leukemia, and he says that's not genetic.
It's not familial.
Yeah.
What they call
Yeah.
familial. So yeah.
He
All
said,
right.
He goes, it's more could be environmental.
Yeah.
So,
Mm.
okay.
Mm.
So so I'm healthy.
Yeah.
My cat might not be. She got high calcium
Mm.
levels, which means I got to bring her in for more blood tests.
All right.
The kitty cat.
Yeah.
All of a sudden, the commitment to have a cat is going to cost me.
Well, there is that. Got to take care of them, apparently.
I know.
Yeah.
We are Red Eye Radio.
Lines open for your calls. 866-90-RED-EYE on Red Eye Radio.
We're Red Eye Radio. He's Eric Harley, and I'm Gary McNamara. And I think of healthcare and all the insurance I've ever had, when I got to be over 65 and had to apply for, Medicare, I had to drop it in order to be creditable. In order to, when I finally get Medicare Part B, I'm not penalized on it, so I had to move away from it. But seriously, when I had the high deductible, but the health savings account,
Yeah.
that was fantastic.
That's what I have.
It was absolutely fantastic because I got to the point of having like $25,000 that was saved up because I put the maximum in because it was pre-tax.
Right.
And if you didn't use it, you could keep it.
Yeah, it stays with you for life.
Now, I ended up using it. I actually ended up using it for major dental work. But it was still great to have that there.
Oh, yeah.
It was all pre-tax dollars.
Yeah.
And I don't know how much, I'd probably have 40, 50,000 in it now if I had stayed with it. And so the deductible didn't matter that much.
Right.
Because you could cover it
Right.
with that money that you put in.
Right. Yeah.
And to me, and that's what they have to get back to. You cannot have nationalized health care that covers everything. You can't.
Right. No, you can't. You can't pay for it.
Not going to happen.
This is Red Eye Radio on Westwood One.